Thank you, Kelly. Good morning and welcome, everyone. God, this is a big room and it's bursting at the seams. It's nice to see you all here for this such a tournament for the 17th Broken Arrow Conference. As many of you might know, Cystic Fibrosis Canada has been hosting our signature event, the Broken Arrow Conferences, since 1976. And there's been steadfast and long-standing involvement from our Canadian CF clinical community since the earliest days of this event. And we've counted on this involvement, not only to ensure that events such as this are useful, valuable, and worthy, but to ensure the best care and knowledge for our patients. I'm certain that all of us know that last year we lost a giant in the Canadian CF clinical and research community, Dr. Peter Durie. And as we begin this next Broken Arrow Conference, it seemed fitting to acknowledge Peter within our Canadian community, recognizing that he was such a prominent presence at so many Broken Arrow conferences before. I'm sure that many of you knew Peter personally, and those who didn't certainly knew about him. Much has been said about Peter's prolific career, and also about the good man that he was. His professional career and his personal reputation were well known in Toronto, in Canada, and well beyond. The work that he dedicated himself to had far-reaching impact. At clinics across the country, whenever Peter's name was mentioned, it was always spoken with respect and confidence. He received countless patient referrals from outside of Toronto, and there was always the sense that if a patient was referred to Peter for complex GI or liver issues, that patient would be in the best hands. It almost seemed as though if Peter couldn't solve a problem, it wasn't solvable. He was that good. Peter's research was equally respected, and he was at the forefront of work that studied pancreatic function in CF, and his work with modifier genes set the stage for a new field of study and the hope of new treatments for those with CF. Specifics of disease severity, diagnosis, pancreatic disease, these were all realms of study about which Peter became an authority and an expert with international demand. He was a frequent speaker about his work, always keen to share his knowledge and expand what is known about cystic fibrosis. I recently had dinner with Dr. Mary Corey, another of Canada's prominent CF researchers and the creator of the Canadian Cystic Fibrosis Registry. And she reminded me of Peter's dedication to education and his frequent work with students and those just beginning their careers in medicine and research. In fact, some of you in this room today would have benefited from his mentorship. Indeed, Peter's legacy lives on. And of course, Peter was a strong ally and ardent supporter of the work of Cystic Fibrosis Canada, and he generously offered his time and expertise in many volunteer leadership capacities. Most notably, Peter sat on the Medical Scientific Advisory Committee's research subcommittee starting in the 1980s, then was in the executive committee, and then the chair of MSAC for much of the 1990s. In these capacities, he helped guide and oversee all the research and clinical undertakings that Cystic Fibrosis Canada aimed to support. Peter even spoke at Cystic Fibrosis Canada staff meetings some time ago, and he also sat on the medical panels at our annual general meeting, talking about his research and helping all staff and lay members to understand what research work was being done and how our organization was helping to support these efforts. He had such a significant relationship with Cystic Fibrosis Canada, all voluntary and all for the good of the patients. And I couldn't speak about Peter without noting my own personal feelings of appreciation and fondness for him. During his most active time with Cystic Fibrosis Canada, I was a very junior addition to what was then the Department of Grants and Patient Support. And working with the clinic subcommittee, I had periodic dealings with Peter, a University of Toronto professor, the head of the Division of Gastroenterology and Nutrition. I don't even know what these words meant then. A professor, Department of Pediatrics at the Hospital for Sick Children. This is pretty impressive stuff and kind of intimidating, but never once was Peter anything but welcoming, inclusive, respectful, and appreciative of everyone's efforts, and in no way intimidating. And I don't think I ever saw him without a smile on his face. What a great guy. On behalf of the countless patients, families, professional colleagues, and associates whom he touched over his lengthy and impressive career, I say thank you, Peter, for his work in improving the lives of those with cystic fibrosis, for his help in helping the healthcare providers deliver care to this special population, and for the optimism that he provided to all of us. Thank you, Peter.